Tina, welcome to the Wellness Platform. How are you?
Thank you, Wendy. I am fabulous and so great to be here. I'm such an admirer, so it's nice to be here. Thank you for having me.
Yes, I'm excited that you're here. This is your second time on the platform. In a whole totally different role, got so many different things going on. So I'm so excited to share you with our audience. So why don't we start off by you telling our viewers and listeners a little bit about yourself?
Sure. So I am Afro-Latina, Boricua from the Bronx. Woo woo, boogie down. But living in Connecticut now. It was supposed to be just for a 1 year stint, but 23 years later, 3 kids, 2 dogs, we're still here. But I have evolved. I was an educator for a number of years. I taught middle school math, and then I went back to school and became a nurse. And so I've been a nurse now for over 17 years. And I really love that journey. Clinical expertise in OR, quality, regulatory, safety, health equity, innovation, primary care. And so that's me.
I never knew you were a math teacher. That's new. So nursing is your second career.
Correct.
Oh wow, you do it so well. Seems like you were like that was like your primary career path. I love it.
So
And
so
you
yo,
go ahead.
sorry. But I specialize in early childhood development and really focus on 3 to 5 year olds. So I was like, that's perfect. It totally helps me, when I worked in the hospital with, some professionals who act like 3 to 5 year olds.
I love that. And I want to talk more about that because you are a leader in the field. You are a nurse leader, well known in the field of nursing for health equity, everything diversity, equity, and inclusion, health equity, especially. So, when did you transition from the clinical setting into leadership roles?
So that was actually early on in my career, my nursing career, twofold. I think my passion and creativity and interests were just pulling me in that direction as well. But also for work-life harmony, I had to push myself in that direction as well. I couldn't continue to be on call on nights and weekends and holidays, and well as, covering call outs with 2 little ones. So that was how I really transitioned over to that world.
Yeah. And tell us what you're doing now at Yale.
Yeah. Oh, I'm so excited. It's like the Mecca Holy Grail. I'm like, oh, this is where I'm supposed to be. So I am the very proud Associate Director of Health Equity Measure Development at the Yale School of Medicine Center of Outcomes Research and Evaluation, also known as CORE. And so we are one of the leaders in health equity, health quality measurement, development and implementation and maintenance. And I'm really excited because our portfolio now includes health equity, which I get to partner with creative, ingenious, really committed, passionate professionals that are research scientists, statisticians, project managers, clinicians, public health experts, epidemiologists. It's like, again, like the best place to be because I'm with so many huge thinkers and shakers doing this exciting work.
And it totally aligns with your passion because I remember before you got that position, you were saying you want something in health equity. And I was like, wow, like this job is exactly what you wanted. It like fell in your lap. So that's amazing. So what projects are you working on at Yale?
So a lot of it is under contract and still under kind of not the full discretion for public awareness. But we have something exciting now in the early development stages, which is out in public comments regarding developing the social needs screening measure. So the hospitals and outpatient areas would be looking at how they identify and screen patients who have social needs and how they provide follow-up.
Yeah, and that's so important. And I love that that's an initiative that's going to be rolled down. But how are we going to like implement that? Like, I know we have all these great tools, all these great ideas. How do we operationalize that at a clinical level?
Yeah, there are definitely lots of innovation and a lot of organizations that are really doing this well. So there's definitely those case studies out there, as well as a lot of the literature, which I happen to know because that was my focus of my DMP project. So there's definitely lots happening out there. I think for me, um, as you know, somebody who has family still with social needs, um, my biggest recommendation, my strongest recommendation, is to really instill in your organization and in your staff the reason why we're doing this, right? Like it should not be just another checkbox, another thing to report, another, burden. It's really core to the health and well-being of not only that individual, but then that family, that community. And so really helping your staff understand the importance of the screening, and then also, having to be creative and innovative and finding the appropriate resources, because that I understand too, working in FQHC, the resources are definitely always a barrier. But definitely for me, the biggest takeaway is stressing the why and how it's really going to impact people positively to have better outcomes overall in their lives.
Yeah, absolutely. And that's one of the reasons I do the work I do in terms of stress management and the workplace, because as we know, our workforce, we're very stressed out, right?
Yep.
So, one, it's hard to just do the day to day, but to think outside the box like
Mhm.
that, to say, I honor the why.
Right.
People need to take a step back and realize, why are you here, right? Why
Mhm.
are you in the healthcare profession? It's really going back to taking care of society, right? And,
Mhm.
and I think you brought up a good point. It's not just a person, but it's that family unit which impacts that individual. So I
Correct.
think leaders are in a position to help their staff take a step back and reconnect, I always say, with purpose
Yes, I
or
love that.
passion. Why are you here? Why are
Mhm.
you doing what you're doing? Because these are humans we're seeing on a daily basis in the clinics and hospitals. So, so important. And you mentioned your DNP. So Tina and I we're in the DNP program at Quinnipiac University together. Talk about that project. What was your topic? Why did you pick it? And it really aligns with what you're doing now. So.
It did, yes. It was a journey, and definitely something that I am very grateful I did, and highly recommend anybody who's toying or thinking about going back to school for whatever, a certification, a degree, a terminal degree. Do it. Take a class. Start with a class. Keep on going. You will get there. Time's not gonna stay still. So might as well jump in, and by the time you know it, you'll be done. But my project was researching and implementing a social need screening and referral process in an FQHC. So again, it was from my evolution in health equity and realizing just how much of healthcare is impacted by factors that have nothing to do with healthcare. Where you live, where you can play, the food around you or the food that's not around you, the air quality, transportation. Those are a lot of the domains that impact, our overall health outcomes. And it's really important from a business model, I think, right? Like 20% of our health outcomes are just for acute care, but that's how many trillions of dollars that we're just pouring in, and we're only getting a 20% return on investment. So what's that other 80% that's impacting our outcomes, and why aren't we talking about that? And so I'm really grateful that, the healthcare system is at a place now where they're being aware of it and making things, putting things in place to really assist with organizations identifying these for patients. And so for me, it was just a great experience to, one, do that research, and really become an expert in a lot of the best practices out there, from not only screening tools, but also, training, staff engagement, and also like normalizing that conversation with patients. I think similar to like mental health, we have to just normalize the conversation around social need because so many people are in need. And so that for me was the biggest takeaway from the project and getting my degree.
Yeah, I love that. And you are the SMA, you are the subject matter expert. So if you don't know what to do or how to do it, call Tina. She can help you with that. And I know we keep saying health equity, but what is health equity?
So it's really, I mean, there's numerous definitions out there, right? But it's really an essence of ensuring that a person has everything that they need in order to have the best health outcomes. And so for me, it's always that picture of the various people on different bicycles that fit their body versus the same bicycle for every person. It's evolved from that historical picture of the spectators of the baseball game, but that's another kind of example of it. So, in essence, it's ensuring people have what they need in order to reach their best health outcome.
Yeah, I love that. And one thought I'm having is, a lot of healthcare professionals work in inner cities, but they come from the suburbs, right, to work in the city to take care of those community members. However, they're not very versed in what's happening at the community level. Um, it's just this patient's not compliant.
Right.
This patient always misses so what
Right.
are your thoughts around organizations having kind of like a mandate or a requirement that before you work here, you have to have some sort of, I don't know, I don't want to say community service, but you have to get ingrained in the community to know who you're going to be taking care of.
Right.
What are your
Right.
thoughts
Now
on
that, yeah, it's definitely true. And again, it's not just the inner cities that have the social needs, like our rural
that?
towns and agencies, have a lot of social needs. And there's various deserts out there, and other areas as well. So I think, it's really important for people to educate themselves as well as to do the research in terms of the communities that they're going to be working in. Be curious and not judgmental. Stop and pause and ask why. Is there something else going on? Is there something else that is a barrier to this patient being able to make their appointments or to take their medication as prescribed? I really feel that trust is the underlying factor to having patients truly open up regarding their true social needs. A combination of the trauma of having to restate that their current situations is a reality. So there has to be trauma-informed communication as well that providers should also have. But definitely having that trust, because once a patient is vulnerable enough to share that, yes, I have a need, right? Like there needs to be something in place that's going to be able to help them to at least get more information about solving it. Because obviously, health organizations and hospitals and clinics don't have that magic wand that they can't fix everything for every patient,
Mhm.
right? So it's really about empowering the patient and educating them more, and really using the network of community-based organizations and other resources to mitigate kind of the priority for them. And again, always putting the patient as the captain of the ship for devising that treatment plan and what next steps they feel are manageable to do.
Yeah, absolutely. As a provider myself, I always say it's easy to take care of a patient. All you gotta do is listen to them. All you gotta really do is listen to them. You don't have to make decisions for them. It truly is a partnership, but it's really kind of loving what you do. So what I'm hearing you saying, it's more of a personal ownership of you have to want to. And what keeps coming back to me is emotional intelligence, knowing yourself. What are those biases, right? So let's talk a little bit about that, how those play a role in
Mhm.
providers, healthcare professionals, nurses,
Yeah,
all of us.
all of
Um,
them. Yeah.
yeah, not being able to adequately assess a patient's social needs.
Yeah, we definitely have to check our preconceived notions, the stereotypes, the biases, at the door when we walk in. and really make a concerted effort to be present with the patient and their family at that time of the visit, and to really listen. You said it really well. Like, you have to hear them, and understand what they're saying, or what their body language is implying. And again, be curious, and be vulnerable too. I think definitely sharing a little bit about ourselves, or really having that moment of connection, where if there's a similarity or something that resonates between you and the patient, or you and the person you're talking to, share that with them. And I often always have told my staff, when you have a meaningful interaction with the patient, let them know and thank them. Right? The same thing we should do with our colleagues and peers. Thank you for a good day. Thanks for your help with this. I appreciated you. You really helped me out. Patients bring us joy as well, and they help us, rejuvenate our sparks. And so when those moments come as well, we have to capture them and really let the patient know, you helped me today as well. I appreciate you talking with me, your honesty. I really appreciate you helping me listen and hear more. So I think that's also a piece of it.
Yeah, and I think also seeing patients as people, like everyone, including, all of us who's listening to this, want to be seen, heard, and understood. Same for a patient,
Mm-hmm.
but on another level, because they're in your presence, because they're in need of something, right? They're in need of something. So they definitely want to be seen, heard, and understood. So if we can go into a room, or a clinic, hospital, whatever, wherever you see patients or people, just people,
Right.
right? So it's not just patients, but people.
Correct.
Right? Your colleagues want to be
Mhm.
seen, heard, and understood. But just
Right.
go in with that mindset of,
Mhm.
this is why I'm here, because we're all relating, and we're all creating relationships and connections, and patients don't want to be there.
Mhm.
Right? It's not like
Right.
they want to be in your presence in a healthcare institution.
Yeah.
So yeah, so we just have a lot of work to do, and it's not just one thing that's going to fix this problem.
Correct.
So I also want to talk to you about your new book project. Tell us more about that.
I am so excited, Wendy. This is my true labor of love. This is my newest baby. I have three human children and two fur babies, and now this book is another baby of mine. I am a bookworm, an avid reader. Since I was little, I would just devour books. When the circular went home, the flyer went home for the book orders. Thankfully, my parents indulged, my interest, and I would get like 5 or 6 books at a time each month. And as soon as those books came in, I was like, I read them all the first day. Like, that's how much of an avid reader I am. And books are also a source of comfort for me. So when I am struggling with something, or when I am just not finding that I'm balanced or harmonized, I turn to different books to draw from the experiences and lessons learned from others. And also, some of the, sci-fi stuff and the history stuff, all that stuff. But it was really interesting because during the height of pandemic in 2020, as well as kind of around the time of George Floyd's murder, and a lot of the other murders of humans that look like me and my loved ones, um, I was taxed. I was struggling. And, yes, I was going to see my therapist too, but still that wasn't, filling my cup as much as I needed to be refilled. And so I set up one night, and most of my stuff happens late at night anyway, as Wendy knows, when we're texting each other with schoolwork. But it was one of those late night searches, and I was like, let me see, how many books are out there by Latina nurses. And I did a lot of digging, and I didn't find any, not even just one. I found a handful written by Black nurses or on Black nurses. So that really, gave me some joy. But again, there's a need for more there as well. But the fact that there was not one book that I found, and still haven't found to date, by a Latina regarding a Latina nurse about her journey and her story, really struck me. And, Latinos are one of the fastest growing ethnic groups in the United States. Yet our numbers in nursing are not growing as fast. Our numbers in leadership and academia are not growing at all. So it really inspired me to, to curate this book. And the book has been a journey in of itself, because I think I really came to fruition that I was going to write this book back in 2021. And so, it's a journey to find the right publisher, to find the right medium, the right balance of the book. But I'm really, really proud to share that I have 15 Latina nurses who trusted me to share their stories. And now we're trusting everybody else with kind of our book. It is called Latinas in Nursing. I'm hoping that it will be available for purchase by the end of this week. But we're going to have an official book launch on Hispanic Nurses Day, which is September 22nd. So more details to follow on that. But again, this has just been my sense of joy, my rejuvenation. Whenever work got challenging, whenever school got challenging, if something else was frustrating, I just had to think about this book, and it gave me the energy to keep going forward. And so I'm really excited.
That is amazing. And what I think of is legacy.
Yeah.
That's really what you're leaving, legacy. And I think this book is just so important to the profession, and all healthcare leaders need to read it, right? To really understand that journey. And you said something very important, that the numbers are low or they're not even moving.
Mhm.
How do we move the needle on that, right?
Yeah.
Maybe the answer's in that book from one of those stories,
Yeah,
right?
most definitely. My contributing authors have really been so vulnerable in sharing so many of their barriers and so many of their obstacles, but also showing their strength and their resiliency in, overcoming those. Many of them have their own businesses. Many of them are professors. Some of them are just starting their nursing journey. So it's beautiful to see that as well. But that's the intent of this book. And I'm hoping for additional versions afterwards as well, additions after. But really to help those out there now who need that source of strength to get through, whatever obstacle they're facing now, to get through it. To be that extra motivation for those that are in school or thinking about going to school to become a nurse, to do it, because you can do it. And I definitely, in addition to healthcare leaders, I think schools of nursing needs to get this book and make sure, all of their staff and professors that are supporting students of color through their journeys, read it, understand it. I would say high school teachers, guidance counselors, get this for those students who are interested in health careers. Definitely if you are a nurse, you should get this. Or if you are support nursing, you should also get it.
I love it. And I see this becoming a workshop. Now, my mind is like all over the place, right? I see a workshop, I see a book club, I see a course, I see so many things right now with this book, because it's the first. It's legacy. Yeah, this is really cool. You're really leaving your footprint on the profession. This is amazing.
I'm trying, and I'm just really, again, blessed to have a support system to allow me to do this, as well as the trust again of these authors, and sharing their story. And Wendy, I got all that stuff on the list. I got, we have scholarship opportunities is what else I want to work on. We definitely have some merchandise coming, but definitely see, workbooks and workshops, book clubs, book tours, all that good stuff.
I love it. I love it. Yeah, this is amazing. It must have really been on your heart, because you're writing for your doctorate as well. Let's not forget that, right? And that's one reason we're connected, because we the mind is like, yeah. Anyways, that's another episode. But I would love to have you and your authors back on to really amplify their story, to amplify the book. I think by any medium possible. I think people really need to hear it, and let's amplify. So where can people go to get the book when it's available?
It'll be on Amazon. Yep.
Okay.
So yeah, but it'll be definitely available at Amazon. I am definitely looking to ensure that it's out, at other Latino bookstores too. So I have them on my list of, hey, guess what? This is out now. Don't you want to put it on your shelves?
Yes.
So yeah, definitely Amazon will be the easiest way to get it. And then Latinas in Nursing, the website, latinasinnursing.com, should also be live the end of this week so that people can go there as well, learn a little bit more about the authors, look for upcoming events, nominate other Latinas and nurses they would think would be a good, would be great for me to connect with, to see if I would feature them as well on the next version, the next edition, because I'm already planning version 2 coming out hopefully May of next year.
I love it. I love it. And all the stories that are in the book, was there any common theme?
Yeah. So there was 2 that were really powerful to me, and I'm like trying to figure out how I'm going to incorporate it into the next version of it, the Latinas in Nursing Volume 2. But one was really mental health, and how so many of the authors were vulnerable enough to share, some of their struggles with mental health during their journey and their life experiences. And I was so grateful that came out, because again, that's another one of those topics that's stigmatized and tabooed, and we don't talk about it. Like, listen, I see my therapist, right? Like, thankfully now I don't have to see her as regularly, but when I needed to, I was seeing her every 2 weeks, and it's okay, right? Like, it's okay to go out there and get help. The other big theme that came out was imposter syndrome. Yeah, and I was really interested by that. I personally don't subscribe to imposter syndrome. Like, for me, I just feel that it's just another form of bias and racism in which the systems aren't adequately supporting us and sponsoring us and mentoring us, so that we have the tools and the skills to continue to grow in new spaces. But it was very interesting that some of the authors did really identify it and named it, imposter syndrome. So that was something else that was really powerful.
Yeah, those are 2 powerful findings. Very interesting. We have work to do.
We do. We do. And again, this book is, one of those tools I'm hoping people will pick up when they need it.
Yeah, I love it. And Tina, how can people get in contact with you?
So I am on LinkedIn, Tina Loarte-Rodriguez, as well as on latinasinnursing.com. There will be a link there as well to send me an email.
Awesome. Now, Tina, before we get out of here, I want to take you through a rapid fire. Is that okay?
I love it. Lightning round. Let me get ready.
Awesome. All right. Tell me the first thing that comes to your mind to finish the statement or answer the question.
Okay.
Wellness means?
Self-care.
I know I'm stressed when?
I have no patience for the things I love.
That's a good one. That's a good, you have to have some self-awareness for that one. I love that one. And your go-to stress management solution is?
Depends. Books are one for me. Sometimes it's a good laugh. But I think also massages. Massages have been a nice source for me. And meditation too. Meditation's a good one.
I love that. And what is one thing a healthcare professional can do tomorrow when they return to work to really help increase their health equity awareness?
I think, again, just pausing and recognizing that any person you're interacting with is a person, and see them for what they are. Meet them where they're at and truly listen to what they're saying to help them get to where they want to be.
And what is something people get wrong about you?
Oh, that one always gets me. I think I still have to go back to the same answer of I don't care. I don't care what they get wrong about me.
I love that. I love that. What would you tell your younger self?
You got this, girl. You are doing amazing things. Keep doing it. I'm so proud of you.
Oh, that is so sweet. And my last question is, what is something you learned about yourself during the pandemic?
Oof. I can do hard things. You know, I have faced many, many challenges throughout my life, unfortunately, but definitely I think it really, you know, fortified my conviction that I can do hard things.
Absolutely. Well, Tina, this was amazing. Follow Tina on LinkedIn. Go get the book when it comes out, and we will have her back and hopefully some of her co-authors.
Oh, I love that, Wendy. Thank you so much. And thank you for all that you're doing. You're rocking it out too.
Thank you. Thank you.